On page E6, on E6, anti-anginal drugs. So again, what is that? So CHD is the term they commonly use. It stands for Coronary Heart Disease. Coronary Heart Disease. It's also known as CAD, Coronary Artery Disease, means the same thing. In fact, I always learned it myself as coronary artery disease, but more recently they've been calling it CHD for coronary heart disease. The problem is what? The problem is atherosclerosis in the coronary arteries. So as we've learned, as the coronary arteries get progressively more clogged up with atherosclerotic plaque, that reduces the flow of oxygenated blood through the vessels to the heart, causing myocardial ischemia. When the heart muscle isn't getting enough oxygenated blood, it causes a pain. It hurts. Frankly, that happens anywhere in our body. If your skeletal muscles in your leg aren't getting enough oxygen, they cramp, they hurt. When our heart muscle isn't getting enough oxygenated blood, it hurts. The only difference is that where the person feels the pain emanating from is not from their heart itself, but from their left shoulder and radiating down the medial side of their left arm. So this phenomenon is called angina pectoris, pectoral meaning shoulder. So this is really a pain in the left shoulder, but it's really because of the heart muscle not getting enough oxygenated blood. This is called a referred pain, a referred pain. It's a pain really originating from the heart, but it's perceived, not referring, but referred pain. It's perceived as coming from the shoulder. So that's a referred pain. Now, just a little bit of context. People who are prone to this problem because they've got clogged up coronary arteries, as long as they're sitting in a chair, okay, so here's my prop. All right, I'm sitting in a chair. I'm watching television. I'm not doing much. My heart rate is pretty slow. The demand of oxygen by my heart is pretty low. But anytime I'm stressed, either due to physical stress or emotional, what's an example of physical stress? I'm going to start to run. And my heart starts to speed up, sympathetic response. Or maybe it's not physical stress of running, maybe it's, oh my gosh, emotional stress. So what happens during emotional stress? The same thing as physical stress, sympathetic response. All right, so anytime somebody's heart starts to speed up, it's working harder and it needs more oxygenated blood. Because these arteries are so clogged up, they may be able to provide sufficient oxygenated blood when the person's sitting, but when they're stressed, the heart is not getting sufficient amounts of oxygenated blood, and that brings on myocardial ischemia and angina pectoris. So it's usually brought on by physical or emotional stress. Why do we mention that? Because a lot of people get stressed out just going into a dentist's office. You think that's true? You know some people who really have a phobia about dentists, dental offices, just like some people can't have a phobia with going on airplanes. Huh?
Oh, I was just going to ask, don't women have a different type of...
Yes, women, thanks for mentioning that, Valerie. Women may actually manifest it not quite so consistently in the left shoulder. In fact, they may feel it in both shoulders, and in fact, they may not even experience pain in the shoulders at all. They may experience it as nausea. So there are some differences. So it's certainly worth knowing the differences between men and women. However, men are more prone to cardiovascular problems in general until the age of about 50. Because women are protected in part by estrogen. So up until menopause, most women just don't, in general, have to worry about cardiovascular disease. So most of the people with under 50 who have cardiovascular problems are guys. After the age of 50, when women no longer are protected by that estrogen, so then their risk of cardiovascular problems, like that we've been mentioning, atherosclerosis, high blood pressure, and so on, starts to catch up with the men, and in many ways actually surpasses men in the probability. So that's looking at it as how it lays out in terms of age-wise. So what are the medications that are given to reduce this risk of angina pectoris and the incidence of angina pectoris? The most important drugs are the nitrate drugs like nitroglycerin. And another thing that they sometimes do, since anxiety or stress is what can trigger angina, is if somebody's got a real problem with this, they could give them an anti-anxiety drug like Valium or something. So how does nitroglycerin and the other nitrate drugs work? They directly relax vascular smooth muscle of the arteries, causing a generalized vasodilation. Now, I don't know how many of you might remember from physiology or other classes that they actually discovered a neurotransmitter released by some neurons that is nitric oxide, or NO. And nitric oxide is a neurotransmitter that has the effect of relaxing vascular smooth muscle, leading to vasodilation. In fact, this is exactly how the drug Viagra works. It dilates the blood vessels in the body, including in the penis of a guy, increasing the flow of blood into the penis. Well, nitroglycerin mimics the action of nitric oxide. So because it mimics the action of this neurotransmitter called nitric oxide, it relaxes vascular smooth muscle, leading to generalized vasodilation. Now, our first thought is if this drug dilates vessels, then obviously that should increase blood flow to the heart, right? It dilates the coronary vessels, increasing blood flow. And it does do that. But actually, the greater benefit of nitroglycerin, the more important benefit, is that by causing generalized vasodilation, let me ask this question. Do you think, and I've asked this before, do you think it's easier or more difficult to push the blood through the vessels of the body if they're constricted or if they're dilated? Which makes it easier to push the blood through the vessels? If the vessels are narrowed and constricted or dilated? Dilated. So if this drug dilates not only the coronary arteries but all the vessels of the body, which it does, it makes it easier for the heart to push the blood through the vessels, and it reduces the workload on the heart. That's really the main advantage, the main purpose of the vasodilators. So even though they're commonly called coronary vasodilators, they dilate not only the coronary arteries, but all the arteries of the body, making it easier for the heart to push the blood through the vessels, and therefore reducing its need for oxygen, because it doesn't have to work as hard. Now, as far as how you take nitroglycerin, if you need a rapid onset of action, they take it sublingually under the tongue. They also have a spray they can spray into the mouth buccally. It has a short duration of action because nitroglycerin is rapidly broken down or inactivated in the liver. On page E7, as far as other effects, any drug that's going to cause generalized vasodilation may create a flushing of the skin, a migraine-like headache. Because it's dilating vessels and lowering blood pressure, it can lead to postural hypotension and even syncope because of the drop in blood pressure. And I want to remind you of a concept that we introduced to you, that a drug that just dilates vessels but does not have a direct action on the heart, you'll remember that by causing generalized vasodilation, that's going to lower total peripheral resistance, which is okay, but that's going to lead to a drop in blood pressure, and that drop in blood pressure is going to the cardiovascular reflex center in the brain, is going to respond to this drop in blood pressure by causing a reflex tachycardia. We had learned before that any drug that dilates vessels because it's going to lower the blood pressure, it causes the cardiovascular reflex center to trigger a reflex speeding up of the heart rate. So that is a problem with nitroglycerin. I'm going to explain how they deal with that problem momentarily. There are a whole bunch of nitroglycerin products and other nitrate products that work similarly. As we said, there are sublingual tablets, buccal sprays, sustained release capsules, transdermal patches. So they have them in all different ways of taking this stuff. Obviously, somebody would use a transdermal patch if they're experiencing angina multiple times a day, so they don't have to take nitroglycerin under their tongue multiple times a day. There are a lot of other nitrate drugs. They go by all kinds of other brand names, but they're all similar. Now, another thing they give to people with angina are beta blockers, especially beta-1 blockers. Let's remember what beta-1 blockers do. They block the adrenaline receptor sites on the heart. So you'd say, okay, so what? So let me remind you. We said somebody who's got coronary heart disease, clogged up coronary arteries, as long as they're sitting and they're watching TV and their heart rate is slow, they're probably getting sufficient amounts of oxygenated blood to their heart. But the moment they're stressed, all right, that increased heart rate puts an increased need for oxygenated blood, and their arteries are all clogged up and they're not getting enough. They can't increase that, provide increased oxygenated blood during stress. So another approach is let's just block the adrenaline receptor sites on their heart. So therefore, even when they're stressed, their heart rate doesn't speed up because the adrenaline receptor sites on the heart are blocked. So therefore, even though the sympathetics will release norepinephrine, even though epinephrine is being released during stress, it can't activate. It is unable to activate the adrenaline receptor sites to cause the heart rate to speed up. So a beta blocker will block stress-induced increases in heart rate and reduce the incidence of angina. It also is given for another reason. It's used as an adjunct with nitroglycerin. You'd say, why? We have explained that nitroglycerin causes generalized vasodilation, which leads to a reflex tachycardia, which we don't want. So, we can block the reflex tachycardia by blocking the adrenaline receptor sites on the heart. So I had mentioned previously that almost anybody who takes nitroglycerin will also be taking a beta blocker simultaneously. That way, when they take their nitroglycerin, and the nitroglycerin causes generalized vasodilation, lowering their peripheral resistance, dropping their blood pressure, there will be no reflex tachycardia. Why not? Because the way that the cardiovascular reflex center causes this tachycardia is by activating sympathetic motor neurons to speed up the heart rate. But that won't happen if you block the adrenaline receptor sites. So that's also why they use beta blockers. So you'll see them in conjunction with each other. All right, now I recognize that as I explain this, you might say, you know what, this is a little bit more than I really care to know about cardiovascular problems. And that's okay. This is supposed to be a low-stress class. Just think of this, that I'm giving you some background in this. These are all very common problems. A lot of people are dealing with cholesterol issues. They're dealing with angina. They're dealing with high blood pressure. And whatever you pick up out of this, you just have a little bit better understanding about what's going on. In terms of adverse effects of being on beta blockers, we know that there's an impaired response to physical and psychological stress. Why? Because you're blocking the adrenaline receptor sites. the heart rate's going to tend to stay slow. They're going to tend to be, have low blood pressure, may have a lower blood sugar level, and so on. CNS depression, because we're blocking adrenaline receptor sites in the body, even some in the brain. And we've even mentioned that it may even have the side effect of interfering with an orgasm in a guy. So, because that's mediated by sympathetics. Now you might say, well, wait a second, Professor Fink, didn't you say we're only blocking the beta-1 adrenergic receptor sites on the heart? That's true. Usually they give a selective beta-1 blocker, not an adrenergic blocker that blocks everything. But everything is dose dependent. As they increase the dose, it starts to block more and more of the adrenaline receptor sites. And my simplified scheme that beta-1 adrenergic receptor sites are only on the heart is just that, a little bit overly simplified. So they can block adrenaline receptor sites elsewhere in the body. On page E8, there are, of course, a whole bunch of beta blockers, and some of the more common ones today are this one, atenolol, or tenormin, or metoprolol, and Coreg. Again, I am not asking you to know the names of drugs. And if you're wondering, so if I was in pharmacy school, what would they be making me do? Memorizing all these drugs. All right? I'm not asking you to memorize names of drugs, but to understand the pathophysiology, the basic problem, and some of the ways that they try to control this. Now, an important group of drugs, a group where you'll probably see one question on the national board. I don't want to overstate it, but you probably will see it, one question. And that's on calcium ion channel blockers. So let me explain what calcium ion channel blockers are. First of all, let me remind you that you all learned in various courses that muscles need calcium in order to contract. Calcium is needed for muscle contraction. In the case of the heart muscle, cardiac muscle, and visceral smooth muscle, there's actually calcium ion channels that open up so that calcium ions flow into the heart muscle cells and into the visceral smooth muscle cells to facilitate contracting of cardiac muscle and visceral smooth muscle. Skeletal muscle cells don't have these calcium ion channels because calcium is stored inside, internally within the skeletal muscle cells in those little sacs called lateral sacs or terminal cisterns of the sarcoplasmic reticulum, if anybody remembers any of that. So skeletal muscle cells store calcium internally, but heart muscle and visceral smooth muscle have channels, pores that open up, and the calcium flows into the heart muscle cells and into the vascular smooth muscle cells, and that's needed for them to contract. So, what would a calcium channel blocker do? It inhibits the entry of calcium ions into vascular smooth muscle and cardiac muscle. It reduces the flow of calcium ions into heart muscle and into visceral smooth muscle, including vascular smooth muscle, visceral smooth muscle in the walls of vessels. So you'd say, okay, so what's that going to do? If there's a reduction, and we're not saying, we're not using the drug to entirely stop the entry of calcium into the heart cells, we're just going to reduce the flow. So as there's a reduction in the flow of calcium into heart cells, the heart beats more slowly. That's called bradycardia. As there's a reduction of the flow of calcium into the visceral smooth muscle cells in the walls of the vessels, they constrict less. In other words, they tend to remain more dilated rather than constricted. Does that make sense? If the visceral muscle doesn't contract in the walls of the vessels tend to remain dilated. So calcium ion channel blockers basically slow down the heart rate, and they tend to prevent the arteries, the vessels, from contracting or constricting, resulting in generalized vasodilation. Now, why are calcium channel blockers so popular? Just before I mentioned the calcium ion channel blockers, I mentioned two other groups of drugs. I mentioned the nitrates like nitroglycerin and the beta blockers. Let's remember, what does nitroglycerin do? On page E6, nitroglycerin, we said on page E6, nitroglycerin relaxes vascular smooth muscle, causing generalized vasodilation. And we told you that that was beneficial in people with angina. Is everybody okay on that? But what's the big problem that taking a vasodilator like nitroglycerin has? It triggers a reflex tachycardia. So we explained on page E7 that one of the ways to prevent the reflex tachycardia was to simultaneously take a beta blocker. What does the beta blocker do? The beta blocker prevents the heart rate from speeding up, and it prevents this reflex tachycardia. So everybody okay on that? So why are calcium channel blockers so important? Because a calcium channel blocker in one drug achieves the same thing that was produced using two drugs. What does a calcium channel blocker do? It causes generalized vasodilation, just like nitroglycerin. But we said that because taking nitroglycerin may cause a reflex tachycardia, you also had to take a beta blocker at the same time. The beta blocker prevents the heart from speeding up. What does a calcium channel blocker do to the heart rate? It prevents the heart from speeding up. So the reason why calcium channel blockers have been so popular is a patient with angina can either take two drugs, nitroglycerin and a beta blocker, or they can take just one drug, a calcium ion channel blocker, and it does the same thing. Does everybody follow that? So you can either take nitroglycerin, which causes generalized vasodilation, and a beta blocker, which slows the heart rate down, or you can just take a calcium channel blocker. That's why they're so popular. So they are used in the management of angina pectoris. They're also used in the management of high blood pressure because they cause generalized vasodilation without any increase in heart rate, and that lowers the blood pressure. On page E9, so just like nitroglycerin, this drug also causes generalized vasodilation, so you can get flushing of the skin and migraine headaches, postural hypotension, and syncope. That's exactly what we said could happen with taking nitroglycerin, because both nitroglycerin and a calcium channel blocker cause generalized vasodilation. It slows down the heart rate. Now, most calcium channel blockers do not have this weird side effect of gingival hyperplasia, but a few of them do, specifically nifedipine. Now, I don't think it's necessary that you remember the drug by name, nifedipine, which goes under brand names like Procardia and Adalat, but I think, as you all probably knew even before you took this class, some calcium ion channel blockers have this weird effect, we don't know why, in enlarging the gums. And they almost always put some case study question where some patient is on a calcium channel blocker and ask, what should you be looking at? Now, normally what we're always worried about is xerostomia. But in this case, it's gingival hyperplasia. That's the key thing. Now, there's a whole bunch of calcium ion channel blockers. The most common, popular one is Norvasc, and to the best of my knowledge, it does not tend to cause gingival hyperplasia, unlike nifedipine does. They have combination products. These are kind of cute. You don't have to know them. This is where they combine a calcium channel blocker with a statin drug, like a atorvastatin or Lipitor. After all, if one of the main uses of calcium channel blockers is to control angina pectoris, the reason why somebody is developing this pain in their shoulder is because their arteries are clogged up with fat, with cholesterol. So they should also be taking Lipitor. So they can just combine them in one pill, so it's got both. Here is where they've combined a calcium channel blocker with actually a diuretic drug.